Simply stated, the more overweight you are, the more likely you are to have health problems. The United States is now seeing a trend of overweight Americans that is reaching epidemic proportions. Currently, there are over 58 million Americans that are considered overweight, 40 million that are obese, and 3 million that are morbidly obese. These numbers are shocking but true. Maintaining a healthy weight is imperative to living a long and healthy life. Being overweight is damaging to your body and increases your risk of many diseases like diabetes, cardiovascular disease, respiratory disease, gallbladder disease, as well as breast cancer, colon cancer, joint disorders, sleep apnea, gout, and osteoarthritis.
Being overweight in our society has become an epidemic, and it is almost as dangerous as smoking. It leads to increased risk of all kinds of diseases, such as diabetes, high blood pressure, cancer, and others. It reduces the quality of life. The first issue is not to gain weight. The second is if you gain weight, work with your physician to get an acceptable diet that you can maintain and you can lose weight on and you can do for a long period of time. Managing your weight will prevent things such as metabolic syndrome, which is a combination of being overweight, high blood pressure, and diabetes, which can be absolutely lethal over the years.
Studies have shown that you can improve your health by losing as little as 10 to 20 pounds. But how do you determine your optimum weight? There are two ways to easily figure out what a healthy weight is for you. One way is to calculate your body mass index, or BMI, which is a function of your weight and height. For example, if you are 5'5", a healthy weight may range between 120 pounds and 150 pounds. For someone 6 feet tall, a healthy weight could range between 140 pounds and 180 pounds. At 6'5", a healthy weight might range between 165 pounds and 205 pounds. Another way to determine if you are overweight is by measuring your waist and hip circumference. In the most general terms, if the ratio of your waist to hip circumference is greater than 1.0, you are more likely to be considered overweight or possibly obese. You can easily access information on both types of measurements on the internet or by contacting your physician. There is a solution to being overweight. It's a slow, steady weight loss program that includes an exercise regimen and a diet that follows food guidelines. The most important thing you can do at first is to determine a realistic, reasonable goal weight and start working towards it. Here are some simple ways to start losing weight. Increase your daily activity. Drink at least 8 glasses of water a day. Reduce the amount of fatty foods you eat. Increase the amount of fruits and vegetables in your diet. Stay away from fast food, unless you are going for the salads. Determine a proper portion size and only eat that amount, and do not eat after 8 p.m. All of these suggestions sound quite simple and obvious. It's making them part of your lifestyle that's difficult. But remember, little changes can yield great results.